Welcome to this podcast from Yuko Health to our community and every single one that also is watching these videos, because it's important to know what happened with our health. Actually, we're going to talk about this: syphilis, the silent surge, and what our community needs to know about it. Syphilis isn't just a historical footnote; it's a growing public health threat, and it's hitting closer to home than many realize, actually. Across the US, cases of congenital syphilis have skyrocketed, with nearly 4,000 newborns affected in 2024 alone, a 700% increase since 2015. This is impressive. Here in Umatilla County, rising STI rates, limited access to care, and funding cuts have created dangerous gap in prevention and education. Syphilis is preventable, it's treatable, but only if we talk about it, if you know what is happening to your body, and if you are accountable as well. So today with us is Dr. Haydee Indriago, which is Yuko Health Communicable Disease Manager. Thank you for being with us.
Hi, Paula.
And I think that the basic question we are going to start is, what is syphilis? And if you can explain us a little bit about the stages also, that would be helpful.
Yes, infection or disease from syphilis is very, very interesting. Syphilis is a sexual transmitted disease caused by the bacterium Treponema pallidum, and we call the great imitator because they have so many symptoms and different stages, local symptoms and systemic symptoms. So I would like to start to explain the different stages, the different phases. The first phases is early syphilis. They can appear local manifestation like a chancre. They occur 2 or 3 weeks after the first contact, the sexual contact, and disappear alone without treatment. Okay. After 2 or 3 weeks, there appear some systemic symptoms like a rash and your feet and your hand on all body, hair loss, inflammation for the lymph node, fatigue, fever, and you can think this is another disease, but for this reason we call the great imitator. And it disappeared too without treatment. And after the second phase is the latent phases, is about 1 to 2 years that you have the disease, but you don't see any symptoms. When you have the first years, we call these phases like early, no primary, no secondary. And when you have more than 1 year, we call these phases like unknown. And the tertiary syphilis is you can spend like 50 or 30 years with this disease, and they affect a different system like a neurology system, cardiovascular, osteoarticular system, and they produce damage. They can repair because they spend so many times the bacteria in your body.
It's gonna be too late.
And make all these. But sometimes you can get some special manifestation in any stage, like in ocular syphilis. And we have some case here in Umatilla. Wow. This is very interesting. So the people have some problem in her eyes and go to the provider, and the provider make the testing as well. Bingo, it's the ocular syphilis.
Wow.
And the neurology syphilis, and you can get like meningitis and seizures. And then when the doctor made the test, is that you have syphilis, and a affect here is autosyphilis too.
So it is impressive how many different diseases can be related, and you don't connect it at the first time or first stage with syphilis, but it could be. That's important thing, that we can get confused, and that's important thing why we need to get tested and be aware of what is happening in our bodies. Also, I would like to know, I don't know if you understand why we have been seeing this increase of syphilis nationally, and is Umatilla County experiencing the same increase, the same trend?
Yes, we have one increase in Oregon and all the state. Start to 24, 2014 to 22, and after decrease a little. We have the same situation here. In 2019, we have only 8 cases, but in 2020, we have 18 cases. It's twice.
Yeah, we double it in that period of time.
Yes, in 2021 and 2022, we have 37 cases, the both year.
Okay.
But after 22, it's interesting. We have a little decrease, like in Oregon. In 2023, we have 37, and 2024, we have like 37 and 27.
How is syphilis transmitted, and what is the biggest misconception about it?
You can get this disease if you have sex without condom, but it's because it's sexual transmitted disease. If you have anal, oral, or vaginal sex, you can get this disease.
Okay.
And this happens when you have sex without condom, when one person has the syphilis and you get the syphilis. How? Because when you have sex, there are some small cut or abrasion,
Okay.
and this act, and the bacteria enter for this.
It could be a micro lesion.
Yeah, and the people don't know. Especially if you feel that this person is healthy, because you can see any symptoms. Like I said before, there are some stages you don't feel anything, and you get this. What think the people? The people think that only you get this disease if you are a risk group. But a risk group, the people is more, they can get more diseases. Like men have sex with men, the homeless people use drugs. There are some community disproportionality affect, like African American, Native American, Hispanic community. But the truth is, every person that has sex with a condom can get this disease. Don't matter if you are poor, rich, or you are white people, or you have married or single, you can get this disease. You have sex with a condom. You have sex with a condom, and the one people that you don't know, this person has syphilis, you can get the syphilis.
Wow. It's not discriminating anything.
No.
Okay. What does the test for syphilis look like? Because many people is wondering. I have been reading in different forums and different comments that they don't know how that look like, and they are afraid of if it's painful or not.
The testing is the key for make the diagnosis for syphilis, and that's very important because sometimes you don't feel nothing. So we offer in Umatilla County Health Department, but all health provider has this testing. The first is rapid test. You can the nurses make up a small pick on your finger, and they take a little blood, and it's rapid test. And you have this result like in 15 minutes. It's very confidentiality. We don't share this information for nobody, only for the person that made the test. It's very quickly. And another, we made the blood test. Is the rapid test was positive, because sometimes this test has a result as false positive. The blood test is easy to. It's very fast, and they take like 2 or 3 days for results. And we offer this. And this test, for blood test, we make 2 different. We make an RPR and antibody. If you are positive for that, we offer treatment too.
I would like to highlight something. Are those tests free?
Oh, okay. So Medicare and any medical insurance pay for this test. But when the people come with us and don't have any insurance, we make some study and we can offer this free.
Okay. So if someone they don't have the ability to pay for the test, they are not going to be rejected.
No,
that's the most
we
important
make
thing.
the test for everybody.
That's important. And if someone tests positive, so what is the treatment process?
It's easy too. It's very easy. There are one medication. The name is penicillin. It's antibiotic. If you have the first stage, like a primary syphilis and secondary syphilis and unknown syphilis, you receive one shot for this. So it's 100% effective for cure this disease.
But the majority of cases,
almost 100%.
Okay.
If they get the medication, like a big line said. But for the tertiary syphilis, and when we don't know how long you have this disease, and pregnant women, they receive 3 doses, different doses every week, 3 different shots. But if somebody is allergic, we can offer another kind of antibiotic, like a doxycycline, but you have to take a pill like a 21 days.
Okay, and can syphilis be passed from a pregnant woman to a baby?
Yes, definitely. And when we talked before about the syphilis is a little decrease in the last 2 years, it's not happened with the congenital syphilis.
Oh God.
Yes, we have some more and more cases, and we talk about the 1 year to another, we have increased like a 200%. That's incredible. And we have, unfortunately, we have more baby with congenital syphilis. The mother can pass the infection for 2 ways, and one for by placentary way, and the another for at the moment when the birth. And there are so many complications for that. But we have to talk about in only one podcast for congenital syphilis.
This following question is interesting because I believe is the key to reduce those numbers. That is so much important here in Umatilla County. And is how is Yuko Health responding to this issue? And I mean, what it look like the barrier, like a stigma, lack of insurance, or misinformation are preventing people from getting tested or treated?
Yeah, I think the big one is the misinformation. The people don't know what happened with the syphilis. They don't know what happened after, before, and is it dangerous or not, what kind of symptoms. So we give information. In every event that we have, we give information for all community. But we try to make a specific information for the like a teenager, because they need to know about that. We go to the school, we make presentation, we talk about STI, but for this level.
Of course.
For this level, for higher school.
You are not promoting have more sex. You
No.
are promoting education.
Before we give this presentation, we send the presentation for the school. They approve what we have to say. But also, we try to give information about what resource we have in our community.
Correct.
Free testing, we make an event at our community, and we call our CBO, our community partners. Even there are some private company like bar, restaurants, they help us. We have like an event at the community, STD testing free for rapid tests, and also we offer a gift card like incentive. the people want to make the test because the people don't want to make the test. And also we work on the, like I said before, bar or restaurant, and we put dispenser condom if the people, the owner want to do that. And we put this dispenser condom with 200 condom. It's free for the place, it's free for the people, and they take this condom. It's very interesting. We have a lot of them in our college, community college. They has in different places in Hermiston, Pennington, Umatilla, and also we offer to the home test kit. Right now we don't have this, but I'm very sure in the next month is the people can call us and receive a testing, a box, a small box, and make the testing.
Even if you don't have, for example, an event close, let's say that if someone wants to take the test, they can call you and make an appointment?
Yes, they can call for Umatilla County Health Department in Hermiston and Pennington, make an appointment, and they receive the test.
So if you have more information, you can visit yukohealth.net. There you have our phone numbers, our email address, everything that you can reach us if you need more information or you would like to make an appointment. That is the most important thing. Thank you, because the resources are for the community, accessible, and the most important thing, we have now the information. If we don't take care of us, it could affect one of our systems. It could be our eyes or brain, or it's so many things that it could be damaged because we didn't take care of it on time. And we have the resources here in our county, in Umatilla County. That's important. Thank you so much for your time, Dr. Haydee Indriago, and thank you for seeing and watch this video. Please share, like, and see you next time.